Take you live now to Durham region, where Premier Doug Ford and Health Minister Sylvia Jones are making an announcement.
There is a planning grant that has been approved for $3 million, and has the planning grant been approved? Is it going forward, and is it now been signed off on?
The answer is yes, but we're looking at this as Durham healthcare altogether, right across the board. And I'm going to pass this over to the Minister of Health here.
Yeah, the announcement today absolutely says that we are building, with Lakeridge Health, a hospital in Whitby. Congratulations. It speaks to the advocacy of the Durham 4. It speaks to the leadership of the Lakeridge Board to look at this in a regional approach to make sure that we are putting together healthcare assets that are going to be sufficient for the entire Durham region. But yes, the Whitby Hospital is going to be built.
Just a quick follow-up. Do we have any sense of timelines on this, capacity for the hospital? I mean, those may be questions that are a little more detailed, but any idea about that?
Yeah, so the board chair and Cindy and I were talking previously before the announcement, and now the exciting piece happens. The community consultation stage will begin, and we anticipate that we will be able to work very closely with Lakeridge Health and get this hospital operational in the next 10 years. But I'm happy to turn it over for more details to Cindy.
Thank you, Minister. So we're really excited about the announcement today. The funding that's been directed to Lakeridge Health really is about building that connected care integrated system. So you will hear that not only will we be able to move forward with the planning for the hospital in Whitby, but we'll also have an opportunity to look more broadly throughout the Durham region, particularly in some of the gaps that we see related to complex continuing care and rehab. So just a really exciting day. I want to take the opportunity again to thank not only the Premier and the Minister, but everybody, particularly the Durham 4 and our elected officials. They have worked tirelessly, not only for their own riding, but also for the entire Durham community. We're really excited about what our future looks like, and we have a lot of people to be thankful for.
Yeah, Cindy, you nailed it. You know, we call them the Durham 4, but they all work collaboratively together. They look at, you know, not just the Pickering, Ajax, and Oshawa, and Bowmanville, and Whitby, but they look at it as Durham as a whole, and every decision caucus makes, it's based on making sure they're consulting with us, and we move forward with it. No one understands their community better than the Durham 4.
Good morning, Premier. It's Jessica from the Trillium. So we've been hearing from the heads of children's aid societies and from child welfare workers that more and more children are entering the system not because of abuse or neglect at home, but because they have high developmental or mental health needs that their parents can't get adequate support for in the community. I wanted to know if this is acceptable to you, that more and more parents are turning over their kids to the system as a measure of last resort.
Yeah, it's very unfortunate that that's happening, but we're pouring money into that. In the last measurement that I've seen, I'm really focused on that Ottawa where they had the strike. Now they're finished the strike, but we're putting $17 million more, and half the amount of kids are going in there. I've asked the minister, I've directed him, I want a full audit of the whole system, and we're going to see where some of the holes are there. But they're going to be well on their way with a complete audit of the entire system. And last time that happened, we saw there was a lot of areas of improvement, let's say.
So the people that we've spoken with have called for an all-of-government solution to the problem where it's just not one minister who takes ownership for it. Mm-hmm. And you have had a lot of social services minister over the years. So is that something that you guys are able to contemplate, sharing that responsibility? And how high is this generally on your radar?
Well, how high it is on my radar? I probably get 10 to 15 calls a day on it. So on my cell phone, and anything that we do it as a collective group, and where we need to get other ministries involved, we don't hesitate to get other ministries involved. But we're going to do a complete audit of the entire system, because I feel we have some issues there.
Good morning, Mr. Premier. Jamie with
Jamie.
CTV. This question comes in from Robert Benzie, Toronto Star. And he's King's Counsel. Last summer, you promised to fix the system over concerns of patronage in the appointments of the lawyers to the King's Counsel. Since July last year, was 91 people were appointed to the King's Counsel, but nothing since. Where are you in fixing the King's Counsel?
Boy, I thought my buddy Robert would give up on this. He's been on this like a dog on a bone. Tell you the truth, people don't give two hoots if they have KC behind their names. The average person, they're worried about health care that we're announcing today. They're worried about affordability and the economy and crime. They don't care about this KC beside their name. So maybe he needs to look for another story.
But
It's kind of a nothing story, to be very frank with you.
Is there not there was controversy with their patronage and the appointments?
I wouldn't say that, Jamie. There's people, it's like QC, Queen's Counsel before. Someone does work for the government, they get KC. They aren't getting any more money, they aren't doing anything. It's just something behind their name.
Thank you, Mr. Premier.
Say hello to Benzie.
Thank you.
Siobhan Morris from CTV News.
Hi, Siobhan.
Will you be realigning the provincial riding boundaries to
No.
match the... No. You didn't even let me get it out. Can you explain why?
Because why change something that works? It works. So it's all good. Just because the feds want to do it, jury rig the ridings, and it's no secret. People do that, governments do that. I'm not doing it. I'm going to leave the boundaries alone, and people will decide if they want to move forward with our government on prosperity, on health care, on the economy, or they want to go backwards and vote for the other guys. They'll have that choice.
Is there a consideration there about keeping a lid on spending, adding more members to the House? Is that a concern for you?
No, we're just leaving it alone. We just aren't touching the boundaries. Less politicians, the better it is. Yeah.
This concludes the questions for today. Thank you for joining us.
I was just getting warmed up. Anyways, yeah, so...
You've been listening live to Premier
folks,
Doug Ford.
thank
Health
you
Minister
again.
Sylvia Jones, they're out in
A great day
Oshawa.
for
This is
Durham
a healthcare announcement. The announcement, by the way, is redeveloping the Bowmanville Hospital to double the hospital's capacity to add 32 new beds. Also building a new Whitby hospital to improve access to fast and convenient care as well. You heard the Premier there taking some questions from the media as well.